COVID-19 forced all of us into a new way of doing pretty much everything. We certainly live differently this year. Some will fade, though, as the pandemic wanes. Others, though, are probably here to stay.
And News 2's Brad Franco tells us telehealth is one of those trends that will continue to evolve.
Unlike a lot of the COVID-19 era innovations, telehealth really isn't that new. The frequency certainly increased, but some doctors say they were already doing up to maybe 50% of their quote-unquote visits over the phone.
A lot of times you don't need to be in a doctor's office or an emergency department to get the right care.
Dr. Robert Oliverio with Roper St. Francis says he's amazed at how well the medical community adopted the video conferencing piece of it and how willing the patients or consumers were to embrace it.
And when you think about it, the way we're having this conversation right now, when the pandemic is over, this will likely be the first avenue for us to have a conversation or a visit, so to speak, with our doctor.
You know, there are going to be patients, and then there are going to be health consumers. And health consumers are going to be looking for information when they're not necessarily sick. And so I think, you know, telehealth is going to be a really important touch point for, you know, healthcare providers and healthcare consumers to get together and figure out what's the next best step when it comes to, you know, the consumer or the patient's journey.
The state and federal government cleared many of the roadblocks to telehealth in regards to what's covered and what isn't at the beginning of the pandemic. State Department of Insurance Director Ray Farmer says that allowed providers to use whatever technology they had to provide care to those who need it and allowed them to bill for those services.
Insurance companies and Medicare, they changed their payment policies to increase access to telehealth. That included changes like waiving copays, increasing reimbursement rates for providers on par with their office visits.
Farmer says he expects those temporary measures will be made permanent. Dr. Oliverio says telehealth is the gateway to the future of technology as a whole in healthcare and is leading us towards some game-changing advancements.
Can we get them out of the hospital sooner, get them into a home-based situation, but bring patient monitoring to the home so that all that information gets to a provider, a doc, or somebody who's monitoring those vital signs or whatever you're gathering through technology, and you know, basically, you know, finish up what used to be, you know, an expensive hospitalization in the comfort of your own home. I think that's really an exciting part of this.
One of the biggest obstacles is the so-called digital divide and people not having access to technology needed for a virtual visit. Broadband access, one of the glaring issues there that state lawmakers have been focused on when it comes to telehealth, and that goes along with getting kids back to school as well. Brad Franco, Count on 2.